Hello, my name is Dr. Andrew Khan, one of the founding doctors at IVFAustralia. Welcome to Fertile Minds. Today, our topic is, are there any other options before you start IVF? That's actually one of my favorite topics. And actually, I would turn it around and say, you should really be trying every other option and leave IVF as the last option. So the situation is a couple is decided that they want to start a family. There's something simple that they can do themselves or with their GPs before they start. For instance, in terms of lifestyle, decreasing alcohol, cutting down smoking. This is for both husband and wife. Then wife's side can go and see the GP to make sure her pap smear is up to date, do some blood tests, make sure she's immune for rubella and chickenpox, and get that sorted out before they start the family. Make sure you read up a little bit about timing of intercourse, ovulation, and then so that we can try and get the timing correct in terms of when she's ovulating. And after a good 6 months to a year, if that's not working, I would say the next step is to see the GP to begin some basic investigations. We need the basic investigations because we want to see if there is a cause for the subfertility. Is it a sperm problem? So the semen analysis needs to be done. Is it a tubal problem? Is the fallopian tube blocked? So some tubal patency testing, like either ultrasound or X-ray, should be done. Or is it a hormonal issue? Hormonal issue both on men and women's side, and that can usually be sorted out with blood tests. So once we've done all these tests, and if there is a diagnosis, which is in about 80% of the time there will be, then we should specifically target the diagnosis. For example, if she's not ovulating, we can simply solve that by either giving her some tablets or oral ovulation induction agents or some injection, low dose injection to make her ovulate. However, in about 15 to 20% of couples, when we do all these investigations, we cannot find a cause. So tubes are both patent, sperm is good, they're timing intercourse, she's ovulating, but they're still not getting pregnant. This group, 15 to 20%, we call the unexplained infertility group. And even in this group, we don't necessarily have to go to IVF. We can just try and help nature a little bit. When I say help nature a little bit, I mean, okay, if we don't give her any drugs at all, what normally happens is she will produce one egg each month. And the couple has been trying now for 6 months to a year and they haven't been able to get pregnant. So we help nature by making her produce maybe 2, maybe 3 eggs that month, either with oral tablets or with very low dose injections. We usually would follow that up with blood tests and ultrasound to see exactly when she ovulates. And when she ovulates, you've got 2 options. One is just to have time intercourse and hope for the best. The other one, especially in the case where the sperm motility is a bit suspect, we can not have intercourse, get husband to give us the sperm. So we wash and concentrate the sperm and use the most concentrated volume of sperm, little tiny volume, and you put it in a catheter, put it through the cervix and inject it into the uterine cavity or the womb. And the idea with that is, okay, we have increased the number of eggs, so we increased the targets for the sperm, and now we've put the best sperm closer to where the action is in the uterine cavity, which is next to the fallopian tube where normal fertilization happens. So I think there's a few steps we can do before we actually reach IVF. In the case where we are putting the sperm back into the uterus, we call that intrauterine insemination. And I would say that you should think about trying that for 2 or 3 times. And if you are not pregnant, then you should go back to your fertility specialist. And maybe in that situation, we can talk about IVF. We can think about IVF. If we do get to IVF, we do need IVF, and there will be a percentage of couples that need IVF. You don't have to be frightened about IVF. IVF nowadays is very simple compared to when I first learned about IVF about more than 20 years ago. Now the drugs are so simple to give, the stimulation, the monitoring, the egg collection is all very simple. In fact, what I've done is I've started up a low dose, minimal stimulation clinic where we're giving very low dose and we're just hoping to get 3 or 4 follicles. We will collect those under, not under general anesthesia because there's so few eggs. We'll collect them, fertilize, and then we replace 1 embryo. And the whole process takes about 2 weeks. And then basically it's a waiting game. After we put the embryos back in, we wait for 2 weeks to get a pregnancy test. So don't be afraid of IVF. If you need it, then it's a very simple process. And we can help you at IVF Australia. Thank you for listening. If there's any questions, please fill in the comment section and I'll be happy to answer your questions. If you want to hear or see more videos on anything related to fertility, please press the subscribe button. Thanks again.